Hello, and welcome to Burgess Plastic Surgery. My name is Elisa Burgess, and I'm board certified by the American Board of Plastic Surgery. I've been in the Portland metropolitan area since 2001. We have a lovely boutique practice that focuses on the highest technology in medical grade rejuvenation and in plastic surgery. There are several aspects of our practice that we focus on. One of them is body contouring. For the body, we consider doing tummy tucks, vasor liposuction. We do brachioplasties, which are improvement for the arm area as well. For the breast, we have many different layers of the breast that we can work on. Some people want to be larger, and we consider breast augmentation for them. Sometimes they need a breast lift as well as the augmentation. And then also we have a mastopexy or just breast lift alone. Breast reduction is also an option for very large-breasted women that have symptoms. And then there's post-mastectomy reconstruction. For the face, we oftentimes consider face and neck lift and blepharoplasty as our mainstay for plastic surgery. But oftentimes we need to consider doing other things for layering before we consider even doing surgery. We have lasers that can improve skin quality. We have chemical peels. If you're not quite ready for surgery yet, sometimes we consider all therapy, which is FDA approved for brow, face, and neck lift. We can also consider Thermite, which is minimally invasive, heat-inducing for collagen response for the face and neck. And then we start talking about Botox and fillers. We have global fillers, we have fillers for certain creases. There are various ways that we can really make a very nice and natural appearance. The last part of our practice is really the med spa part of our practice. We have microneedling with PRP for facial rejuvenation, acne scarring, and things like that. In addition, we have chemical peels and facials, and then we have massage as well. Here at Burgess Plastic Surgery, we talk about beauty by Burgess, layering in a very natural and a very beautiful way so that nobody really knows that you've had anything done, but you'll just have to keep them guessing. So we welcome you to come to Burgess Plastic Surgery.
Good evening, everyone. Welcome to the Burgess Plastic Surgery annual face event. I'm Debbie, office manager for Burgess Plastic Surgery, and I have been with Dr. Burgess for almost 18 years now, and every year we do an event, it just gets bigger and better. The savings get bigger and better, so I'm so excited that you're here to learn, watch our demonstrations, and take advantage of these savings that we have to offer. So we'll start with skincare. It's 20% off all of our medical grade skincare lines, which is Teoxane, Epionce, Neocutis, and Zeo Skin Health. Skincare is just the best place to start. If you don't know where to start, just start with skincare. You can't go wrong with it, and we really have products for everybody. We're gonna have 20% off the majority of our single treatment purchases. That's gonna be anywhere from custom facials, chemical peels, laser treatments, Hydrofacial, and then we'll have additional savings on Ultherapy, Aqua Gold Microinfusion, and Thermi Eyes, Thermi Tight, Instalift, Kybella. We'll have 20% off facial fillers, and then additional savings on Botox and Dysport. We will have package pricing, and that's where you're gonna get the most of your savings. You're gonna have a lot of buy two, get one frees. Ultherapy is going to be buy one, get one free. If you buy your full face treatment, you're going to get the full neck for free, and that's $3,500 savings. So that's huge. So definitely check that out. We'll also do savings on Coolsculpting. We are offering savings not only on just the submentum area, but we're including it for the full body. And you can get up to 40% off 8 cycles or more. Obviously, there's savings for under 8 cycles, but 8 cycles or more is where you're going to get the maximum savings. So check that out as well. Drum roll, please. We are offering the Golden Ticket Raffle again this year. That is $7,000 worth of treatment for free. That's one whole year of IPL, Clear and Brilliant, Hydrafacial, microneedling, chemical peel, Botox. Our skincare specialists are going to bring the winner in, sit them down, do a facial scan with our Visia, and then they're going to plan out your entire year of treatments and figure out what you need to be doing to get to your optimal goal for skincare. Who doesn't want $7,000 worth of treatments for free? So there is a buy-in. You only have to purchase $500 worth of treatments or products to get entered into this raffle. We're going to be taking purchases up until 3 o'clock on Friday the 15th. So you have time to sit down, figure out what you really need and want from the office and treatments and your goals, and then call us and make your purchases. And if you have questions, we're more than happy to sit down with you and talk to you and make sure that you get exactly what you're looking for. We're also going to be live chatting throughout this event. Lacey and I will be up front, so feel free to chime in, ask questions, and then you can also look at the pricing. We'll put a little PDF in our chat, so you can just check that out, or you can go to our website. On our website, we actually have a Shop Now button, so you can just go up there, click it, and all of our savings will be listed and promotions will be available. You can just click and choose what you want to purchase and check out straight from there. Or you can go to our events page on our website, which is burgessplasticsurgery.com, and just click on the PDF, look at it, and then feel free to give us a call, and we're happy to do it over the phone for you. So, congratulations to 2021 winner, whoever you are. We will find out Monday. And then I'm so excited for you to see the clip of our previous winner. She looks beautiful, amazing. Her skin is awesome, and she feels great. And I can't wait for you to hear from her. So enjoy the rest of the event.
Hello and welcome to Burgess Plastic Surgery. We have an amazing evening for you tonight. The focus is on the face tonight, but we'll be touching on some other things as well. I can't believe that it's been actually 20 years that I've been in practice. It's been an amazing journey, and these providers that will be with you tonight will be telling you a little bit about the procedures, and then we have some volunteer patients that are going to have the procedures as well. So tonight, I'll be talking a little bit and showing some slides, and then we'll actually focus and go into one of the rooms, and so you can actually see some of the live treatment. So we have a lot going on, so let's go ahead and get started. So I chose this first slide because I don't know if you can see on the background, but there's some makeup. And for me personally, I've decided I'd actually prefer not to wear any makeup or foundation. I just want a clear, fresh face. So for me, wearing a mask all day, being in the operating room, I don't really want that stuff on my face. So I have been layering and doing certain face treatments so that I can get optimal skin rejuvenation. So I'm going to share some of those tips for you tonight as well. We are a very warm and welcoming practice. We welcome all shapes and sizes and men and females and everybody else. So I just wanted to make sure that you understand that you're always welcome here as well. Okay, so let's go ahead and get started. And here's the first slide. Oh, and did I tell you that I'm not necessarily an IT person, so I might need a little bit of help tonight. There could be a few bloopers. So that the right one? Excellent. Okay, so there's often this cross section between a natural look and plastic surgery. And that's the tricky part, is that we are trying to create just a better version of you. And I think that's really important. I don't really want to make you look a lot different, but I really would like to focus on making you look maybe just a little younger, a little fresher. Those kind of things are important, especially because it seems like we're such a virtual world these days. So in plastic surgery, there's some simple ideals, and these are having reasonable expectations. Sometimes people come in and they have this laundry list of things, but I just can't deliver them because they just don't have the body type for it, or it would be a magic wand that they want, but in reality, it's several different types of procedures. I wish it was always scarless and with no pain, but there's a lot of things that we can do that are really minimally invasive or non-invasive these days, and then really no downtime, immediate results. And I think actually with plastic surgery and our spa experiences, we're getting definitely closer to this. We have non-invasive things. We talk a lot about layering for a natural result, because really a face and neck lift can kind of pull back, the excess tissue and have it removed. But it doesn't do anything for the rest of the face. And that's where we talk a lot about layering as well. So this is what everybody comes in. They take off their, masks in a protected environment. And they're like, this is, what I want. But again, it's really asking you what your goals and ideals are, because sometimes people want tissue removed, but really they have a ton of wrinkles that are really deep around their face as well. So we talk about what their goals are and what can be achievable. So at Burgess Plastic Surgery, we have it all. So advanced medical grade skincare. And as Debbie mentioned, I think if you're going to spend any money or time, this is really what you should focus on. With advanced medical grade skincare, it's really transformative, and we really have several good skincare lines. Chemical peels are really lovely as well. Other skin treatments we have are IPL. IPL is for brown and red spots. We'll talk about that. Lasers, Hydrofacials, which I adore. I have one almost every month. Microneedling, dermaplaning, and secret. Then we have hair reduction on the face and legs, and non-invasive facial and body treatment. We have minimally invasive face, body, breast, and surgery for the face, body, and breast. So basically, we have it all here. So this just shows you a time sequence. If you look to the left, a young woman, just a little bit older, and then transitioning to a little bit older and older. And you can really see kind of a loss of collagen, descent of the face, and you can start seeing kind of some hooding as well. The wrinkles are kind of starting to form around the nasolabial folds, and you get more textural issues. I think the one thing that I've really learned over the years, and this has taken me a long time, is really sun exposure can create some textural issues. We know that it can create some skin cancer, some brown spots and things like that, but it's really the textural issues that I notice, and it's really in sun exposed area. If somebody wears a hat like this that has a wide brim their whole life for their job, their upper face can look beautiful, but it's really the lower face that has starting to have this textural change. We can analyze your face with our Visia. This is a complimentary procedure. If you'd like to have this done, please make sure you come in with a clean face, because if you scrub your makeup off when you're here, it actually changes and it makes the reading more red. So we need to allow for more time. So you need to ask for a little bit more time, and then we can do the Visia. The Visia is basically this camera and this screening system, and we can look at different things. We can look at brown spots, we can look at wrinkles, we can look at texture, pore size, UV spots, other brown spots, red areas, and porphyrins, which are basically bacteria. So this is kind of what's layering on the Visia, and our goal is to try to improve some of those things. Some of them actually can be improved really with medical grade skincare, but these other techniques that we have can be helpful as well. So this is Visia and skincare alone. And I think that you can see the photo on the before that she has some pigmentation on her cheeks, and then afterwards you can see it improved. The skincare line really kind of leads to amazing selfie, and we'll be talking a little bit more about those. But the Zeo skincare line is really our transformative line. The Neocutis has our human growth factors. Epionce is more natural, and then Teoxane has a resilient hyaluronic acid. All are amazing lines. I actually use them all, but I kind of assess each night, what my skin needs. If you are new to skincare, then we really need to get you with one of our skincare specialists or a nurse, and then you can start talking about the skincare products, because sometimes it can seem pretty daunting. But just like you brush your teeth every morning and every evening, hopefully you do that, then you should be doing the same thing for your skin as well. It's kind of like planting a garden and not just watering it every day and checking and pulling the weeds, but that medical grade skincare is something that you can do at home every day, just kind of like brushing your teeth. This is just skincare alone. So I think this is a really nice photo, just looking at some of the pigmentation that can really slough off even with simple skincare, and just kind of brightening. I think sometimes when we have some of that pigmentation, it can be a little distracting to what's really present underneath. This is medical grade skincare alone, kind of working on some of those brown spots as well, evening out skin tone. And then the tech neck. The tech neck is just a whole new thing, right? So everybody's been on their phones, everybody's been on the computer, and oftentimes they just notice their neck. So all therapy is something that we have. All therapy is FDA approved for brow, face, and neck lift. And it's actually really quite helpful for brow elevation. I personally like all therapy for my brows, and I do some Botox too to just try to keep my eyes open. But it's about a 25% improvement for these areas, the brow, face, and the neck. It's actually FDA approved for the décolleté as well. And we start seeing some improvement slowly over time. I think that 3 to 6 months, we start seeing some improvement. And then basically I have it done about every 2 years, and I'm very happy with that.
But that layering effect, so this is actually chin liposuction and all therapy. We can remove some of the fat with liposuction and then all therapy over the top to try to improve the skin quality. That's a great combination. We also have Thermite, which is radio frequency, is minimally invasive. So I numb up the area of concern. It can be done on the face, the neck. We do it on other parts of the body. The pencil probe is placed kind of underneath the skin and it heats. So it works by tissue contraction, and that's via radio frequency. Thermite and liposuction can be done to improve neck as well. So if people have kind of thicker necks, that's an option. And then moving to Coolsculpting, which can be done for the body as well for the neck. This is just Coolsculpting, which is FDA approved for fat reduction. And again, about a 25% improvement over time. Usually it's not just one single treatment, it's a series of treatments. And our gals are really good about trying to figure out a treatment plan. But it's permanent fat reduction. It takes a couple months to start seeing a result. This is just a cool mini treatment for the under chin area. And you can see that you can actually get some tissue contraction with it. We don't necessarily tell everybody that you can get some tissue contraction with it, but definitely with a cool mini, we can see that. So that's a nice thing about Coolsculpting versus just liposuction alone, is that I do think you can get some skin treatment. It's not FDA approved for that, but we do see that a little bit in clinical practice. That's just a side view as well. This is just another one, cool mini and all therapy. Again, these combination therapies for fat reduction and then doing something to improve the quality of the skin or working on tissue contraction of the skin. And then now we're ready for our first adventure. We're going to head over to the procedure room and then Coolsculpting. In the procedure room, we have our patient, and then we also have our nurse, Shelly. So here we go. And again, we might be a little slow for some things, so just be patient with us. Remember, we're a medical practice. We're not a technology company. So, okay, you ready, Miss Shelley? Tell us about Coolsculpting. I don't know if we can hear. Can you guys hear? They're working on it. Okay. So back to Coolsculpting. You just give me a thumbs up whenever you're ready.
Okay. Hello, guests. Can you all hear me?
Yay, we can hear you. Bravo. Okay, go ahead. Tell us.
Can you hear us in procedure room?
Yes.
Okay, great. Well, I'll just get started. So we're here getting ready for Coolsculpting. We have our lovely patient here all set and ready. And we've actually done one section already. So we're all set up to go for another treatment area. So we've already done the marking. They'll be to her abdomen, the other side here. And so, can they see us, Taylor? Oh, good. Okay, now I hope you all can see. All right, so we're just getting ready for this area here. So what we do when we get started, we have a pre-treatment wipe that will cleanse the skin, and that just removes the oils from the skin so that the gel pad can adhere. After this, we apply a gel pad, and that helps to protect the skin as it's suctioned up against the cooling plates. So we'll get that applied.
We slowly see a reduction in fat.
And with this, it can be a little bit messy, washes out of clothing, so you don't have to worry about that. All right, this might be a little bit cold. Just give you a little warning there. Okay. And now we can apply the applicator. So for most of the treatment areas, the treatment runs for 35 minutes, and then we follow that with a 2-minute manual massage to the area to help increase the fat reduction and break up any of those fat cells. Then we follow that with some of our acoustic massage. Again, it just helps to stimulate increase in circulation to the area and get the process started. So let's go ahead and get the applicator on. So again, it's a suction device, so it'll draw that tissue up. Should be comfortable though. How's that feel?
Feels great.
Good, okay. So then we'll get it all situated, locked in, secure, and then we can start the cooling. So I'll have you just hold that steady for a moment.
You can see how comfortable
We'll
that
use our
is.
little fancy boppy pillow device, the multi-purpose pillow. All right. Let's move that forward a bit. Okay, you can let go of that. And now once I start the cooling, it might feel a little stingy, a little achy, but that's just really temporary for probably about 5 minutes, but it's nothing extreme. And then they're pretty comfortable. The area goes numb. For the rest of the time, then one can, check their emails, read a book, or just relax, take a little nap if they want. Okay. So let's just give this a little more security there. All right, so we're all set up. Keep her warm and cozy, and we'll start the cooling. There we go. All right, and Coolsculpting is great. It's non-invasive, no downtime. So it's an excellent option for those who just can't afford to have a surgical approach, or if they just don't require that. Now, not everyone may be a candidate, but for those who are, it's an excellent option. So it's more for those stubborn pockets of subcutaneous fat resistant to diet and exercise. It's not for significant weight loss or large areas of fat reduction necessarily. And so the typical downtime, again, there's no real downtime. You might have a little numbness, a little tenderness, but you don't have to change your activities. You don't have to take any time off of work or anything like that. And so again, it runs for about 35 minutes. And then we can just change the area. We can customize it to suit one's needs and body shape, where they carry their particular pockets of fat. So if anyone is interested in Coolsculpting, I would love to meet with you in person for a consultation. We can talk more in depth about it, see if you're a great candidate. We can customize a treatment plan and help you to reach your aesthetic goals. All right, now back to Dr. Burgess.
All right. Okay, well, Shelley's a very experienced practitioner. I'll tell you, our providers are really, really well trained. So now, hold on a second, moving on. There we go. We'll be transitioning to Ipl and Lasers. And again, just back to Coolsculpting, there's the Cool Mini for the neck. So that's why we brought that up. But we thought it'd be important for you to kind of see the concept of Coolsculpting and how easily that it is done. So on to Ipl and Lasers. So we have our Limelight. This is a really great intense pulse light. And this is for pigmentation, which is brown spots on the face, veins and little vessels, which are red spots, acne, and actually hair reduction. And this gal has a little bit of all those things. Here she is before on the left, and then here she is after. IPL, I think, should be done at least 4 times a year. I do it about 4 times a year, and there's some good 10-year data looking at just facial rejuvenation with IPL alone, not just improvement of the pigment and things like that, but just for rejuvenation by itself. So I think in your maintenance plan, having it done about 4 times a year is really helpful. And you can really see the before and after here. And again, medical grade skincare, IPL really can be transformative. And then we also have a Yag Laser. For the Yag Laser, we like to do laser genesis. This is like a no downtime lunch thing. I actually, when I do IPL, I have them do IPL and a modified laser genesis. This is a laser genesis where they basically use this laser and they run it back and forth over your face. You can just feel the heating, and it works for some light skin resurfacing texture, wrinkles. I actually think it helps with pore size as well. Also, the Yag can be used a different way for vascular lesions on the leg and the face. The legs are a little tricky because they're kind of like weeds in your garden. They always like to, come back, but the leg veins can definitely be done. For the face, it can be done as well. The nice thing about this Yag Laser is that it doesn't know your skin color, which is great. So you can use it with darker skinned people as well as lighter skinned people. And that's not the same for all lasers. Hair reduction that we have can also be done on dark skinned people as well. And then now we're going to move to room 2 for IPL and laser genesis. So I think in room 2, we have Miss Haley.
Everyone, tonight, can you guys hear me okay? Tonight we are doing the IPL right now. Haley is doing IPL on our patient right now. As Dr. Burgess had said before, that IPL is great for reds and browns and overall tone of the skin. With the IPL, it kind of feels almost like a rubber band snapping against the skin. People have said that it's actually, somewhat comfortable, not too painful. When it comes to IPL, you really want to be and
Okay, pop in there. Have her transition, yeah. Okay, he's gonna pop over.
Okay. Sorry for that, you guys. Again, when we're doing IPL, no self-tanners, no retin-As for a week, just so that we can get the skin ready for the treatment itself. Right now, again, Haley is doing the left side of her cheek. She's focusing on both the reds and the browns of the skin. And sometimes when we're doing IPL, the brown can actually get a little bit darker before it starts to go away. How do you feel?
It doesn't hurt. I feel light bugs me. But
So the light definitely gets a little bit bright, but yeah, like I said before, it really just kind of feels like almost like a little rubber band snapping, but that doesn't continue once we're done with actually the light itself.
That's great.
Yeah, so we're gonna switch over to laser genesis. She's gonna go ahead and do the right side of her cheek.
Yeah,
Laser genesis is actually one of my favorite treatments that we offer here. For myself personally, I have very large pores and very textured skin, and this treatment is amazing for that. So this treatment really is going to help with the large pores, like I said, the textural differences that we have, but it's also going to focus on the redness of our skin. People who suffer from rosacea, just overall red from the sun damage, things like that. And it really just is kind of a warming to the skin. If it starts to feel a little bit too hot in one spot, we just quickly move over to the other spot. But again, a comfortable procedure, and there really is not a lot of downtime with either one of these procedures, whether it's the IPL or the laser genesis itself. You're going to leave here a little bit pink to red, but within the next 24 hours, it really starts to calm down and go away. So you can resume your normal activity after that. And yeah.
back to you, Dr. Burgess.
Okay, all right. Thank you very much. So if you have a lot of pigmentation on your face, the best thing to do is to kind of start your medical grade skincare and see if you can kind of clear some of that off. And then start your IPL, because if you have too much pigmentation, it can be just too much, effect on your face. And then after you've had a couple IPL treatments, and then you can consider doing the IPL and the laser genesis. So I've been doing it now for so long, I don't have as much pigmentation. And so the IPL I can do, and then they just do the laser genesis right on top of it. So it's actually a combo treatment, but not recommended for people that have a lot of pigmentation right away. And then now we're going to go ahead and move on to injectables. So we have lots of injectable options. In fact, I just listed some of them here. The more common ones might be Botox and Dysport. We have lots of hyaluronic acid. Sculptra is for global filling. And then we have Aquagold, and we'll show you that tonight. And then microfat and nanofat. So we got lots of options for you. So Botox is pretty simple. Botox is FDA approved for many parts of the face, but you have to think about it as a wrinkle reduction, like for muscles. You can't put it all over your face deeply because you want to make sure to still be able to smile, but it's really good for the glabella area, which is the area in between your eyebrows. And you can see her before and you can see her after. And I think sometimes we are looking at our computer so much or squinting outside that you can develop these pretty heavy lines. And once they set in, they're really hard to get rid of. So the earlier you kind of start with a little bit of temporizing Botox, the better. The Botox really only lasts about 3 months. I recommend about every 3 months, and that's on the a maintenance plan as well. When you do it every 3 months, by about 19 months, you start to get some permanent, so you won't need to do it as often. So I myself only have to do Botox about every 4 to 6 months, just kind of depending on, what I need. We can do some of the forehead as well. If you have too many heavy lines, we have to be careful about how much we do, because it can actually drop the brow just a little bit if you weaken these muscles up here, which are creating those lines. Sometimes if people have really, really, really heavy lines, then they're raising their forehead so that they can't feel the skin on their eyelids. So we're assessing your anatomy and trying to figure out why those wrinkles are there and how we can adequately treat them. It's really good for a little bit of brow lift as well when done very well in good hands, and then also for crow's feet too. So we've got lots of use for Botox. Hyaluronic acids, we've got basically the full complement. There are ones that are a little bit softer, ones that are a little bit firmer. So we have to think about how we're placing them either superficially or deeply or in certain crevices. Some of them will be placed right on top of the bony structures as well. Our nurses and myself do the fillers, and I have to say we're all very well trained. This is a good example of a filler. You can see on, if you think about it as anatomy, it's on her left photo, but basically her left side. You can see there's a really deep crease there. She had Restylane to those areas. This is another gal for Voluma. Voluma is kind of for deep cheeker areas, but you can also do it kind of more superficially. Juvederm and a little bit of Botox. And just doing some of those things can create a nice, what we call OG curve for the upper face. I think sometimes as we age, we become very vertical, and then we kind of start losing volume, and then this part comes heavier. And so if we could add just a little bit of volume and cheek through that area, it can just be really pretty, very simple to do. This, you can see just a little bit of volume. You see where the light kind of just shines on her cheek, giving her that more youthful cheek, and then kind of filled in some of those lines around her nasal labial folds as well. And then, of course, there's always lip filler. We have several different types of lip filler, and it really depends on people's goals. Some people want fuller lips, some people don't want full lips, some people just want to have just a little bit more. So we can accomplish all those things as well. Sculptra is polylactic acid. It's the same stuff that suture is made out of, but it's micronized. It looks like it's a milky water. And basically you put it in to create some global volume, different than a hyaluronic acid that's for specific lines and things like that. And here you can see in the slide some sequential photos. And if you kind of look at the gal in the middle, you can see how she's very vertical. She's got kind of the darker brown hair. And then she did a couple vials of Sculptra, a couple of vials of Sculptra, and then a couple of vials of Sculptra. The one on the far right, she actually lost a little bit of weight. So really it's the one just to her left that looks a little bit better. So this is a global filler. We put it up in the temples because people get temporal hollowing and it can make them look more older and more gaunt. We can add it kind of through this area as well. And then now in a more dilute solution for the other areas of the body as well. So anyway, I love Sculptra. Sculptra is a really great product. Again, just kind of, we call it the Sculptra Glow, where I think people get an improvement in their skin quality as well. And now we're going to go to room 1 for Botox and Aqua Gold. So Aqua Gold, while they transition over, Aqua Gold is this really neat little vial, and it has these little hollow gold needles, tiny, tiny needles, and we can put certain things into Aqua Gold, and she'll explain that. And it can include Botox, which is microtox, which can you can do to help decrease pore size, and then also some wrinkles as well. So, my dear Miss Maggie, are you ready?
Hi, everyone. I'm going to be demonstrating the Botox that Dr. Burgess was talking about. Definitely an easy lunchtime procedure. So it's been FDA approved for almost 20 years for cosmetic use. So tonight we're going to go ahead and hit these little frown lines here. And our lovely patient has shown you kind of these lines here that will really be helped with this. So about 2 weeks from now, she can see results. She's had it before, so it does feel a little bit like a bee sting. There's really not a lot of downtime, but I do tell patients, avoid blood thinners. Try and schedule with us several weeks before an event so you can really appreciate your results before that. But we'll go ahead and we'll just treat this area. You okay if I go ahead and start? Yeah. Okay. And she's iced the area for a while. We don't tend to use a lot of numbing because the product goes a little deeper, so it doesn't always necessarily help that. Was that okay for you? Mm-hmm. Okay, so we'll go ahead and treat. And we've been doing Botox in our office since probably about 2008. So we have lots of experience. Like Dr. Burgess mentioned, you can treat the glabella area, the crow's feet, which is actually already treated here for her tonight, and then the forehead as well, if it's FDA approved. Perfect. I do tell patients as well, just that evening, to limit activity. You don't want to be massaging the area. We really want it to stick where I put it. Just so you get, the results that we hope for, because you're not moving the product around at all. And then our last little poke here, go ahead and frown one more time for me. Perfect. Okay. So we like to kind of check our marks and just make sure we're hitting where we want to be. Okay. And then we're going to go ahead and actually treat with Aqua Gold. So I know Dr. Burgess mentioned that. And I know you can't see it from here, but this is the Aqua Gold. And it's essentially a vial that allows me to mix a cocktail of different treatments all in one. And so tonight I have Botox. So that's going to actually provide microtox. So I've already treated her from basically her collarbones up to her forehead. So that's why she's nice and rosy. And so the microtox will help with pore size and skin texture. And then I added the vitamin C, which of course helps with brightness, overall hydration. And then lastly, there's hydroquinone. And then actually one more thing is the Bellatero. And that's going to basically plump and help out with skin volume. So we're going to go ahead and treat one more time through here. And just wipe off here. And how did you think the treatment went for you with the Aqua Gold?
It was fun.
So we did not numb her tonight. Typically, you don't need numbing for this procedure. So essentially, we're just sort of stamping it into the skin. So we're going to go ahead and treat now. And those microchannels are just going to infuse the products that we put in the cocktail. And then over time, she should have reduction in pore size, skin tone and texture should improve. And we can really target the things that are trouble spots for the patient. If they have more brown spots, that kind of thing. So it's a really great anti-aging tool, but we can pretty much do it on just about any patient, any skin tone, that type of thing. Okay, so we've treated most of pretty much the rest of the area. So I think it's back to you, Dr. Burgess.
Okay, thanks. So we've really liked the Aqua Gold. You have to think about it as more of like a skin treatment. Botox itself, when we do the injectables for crow's feet and glabella and stuff like that, is really kind of working on, certain muscles and lines. But when you do the Aqua Gold, it's this vial and you put the Botox in it as well as a hyaluronic acid and you're stamping it into the skin. So it's kind of a skin treatment. So that hyaluronic acid will provide and draw in that hydration. The microtox will kind of smooth everything out. A little vitamin C, a little hydroquinone. So anyway, there's just different ways to create the cocktail. And we really like that as well. So a lot of our patients do like a series of something, and then they might just top it off then at their next visit with a Aqua Gold. That can be done. You could probably do it like every couple months or something like that. That's one of my favorite. Well, I got a lot of favorites. That's one of my favorites too. Okay, so I think we're ready to go ahead and continue on to the next slides here. Oh wait, actually we're going to do videos. We're going to do videos, a couple videos. So here we go.
So here's a quick recap of tonight's savings. We're gonna actually just post it up on the screen here so you can try to see it. It will probably go away before you're able to read it all because there are so many savings, but just to touch base real quick, 20% off our skincare lines, medical grade, Zeo Skin Health, Neocutis, Teoxane, Epionce, 20% off our single treatments, majority of our single treatments. We have the buy two, get one free packages. We have some bonus buys in there. We have savings even on Coolsculpting tonight. So I didn't touch base on a few things that are on the list in our first video. So do try to read it thoroughly and take advantage of as many savings as you can. This will be listed on our website on the events page. It's also in our live chat going on tonight. And then we'll also have it emailed out to all of our attendees as well. So again, call us if you have any questions, but let's take a peek.
Okay. So now we'll transition just a little bit, talk about microneedling and lasers. So we have skin pen. Skin pen is our microneedling, and just be really careful if you get microneedling that you go to a medical facility, because you want to make sure that the provider's using a clean tip every time. Super important, because you want to make sure that you're having no issues from patient to patient. So this is a very amazing treatment. It's a collagen induction therapy, and basically you're creating little microchannels. It can be helpful for tone and texture, but also for some acne scarring as well. And then sometimes we add a little bit of PRP, and this is just that we had done for Halloween one year, so we thought we would just add that on as well. So while the little channels are open, you can add certain things to help, and the PRP can help with rejuvenation too. So this just shows the treatment being done. It does require some numbing, but it's really well tolerated. You can see that there's some before and after, can help with some superficial pigmentation as well. So for clear and brilliant laser, this is one of the lasers we've had for a long time. It's kind of like a baby Fraxel with microdots. There's a Permea hand piece, which is more superficial for brightening and infusion of serum. And the original hand piece, it's a little bit deeper for tone and texture. It's actually good for all skin types, which is unusual. Again, we have to be careful with certain lasers for darker skin types. And there's really no downtime. You may have little tiny, kind of flaky stuff, but any of these things usually takes kind of a serious, and we like to customize for people as well. Clear and brilliant laser can be really good, again, for that pore size, but can also help with some acne scarring. And I like to do it. I usually do it several times a year just for facial rejuvenation as well. Transitioning now to a CO2 laser, we'll have a newer secret CO2 laser, but we love our Smart Skin CO2 laser. We've had really amazing results with it. So I like this photo alone because I just think it shows you the magic of just doing a CO2 laser. So that's all she's had done. She hasn't had anything done, not a face and a neck lift, but she just looks more rejuvenated. We did do a Madonna Lift for her as well. Do you want to grab? And this Madonna Lift shows that she has some improvement in the area around her eyes. So for the Madonna Lift, we actually put a little contact in to protect your eye. We numb up all the way around. I like to give a little extra love by actually adding a little bit of CO2 up here, but I actually laser right on top of the eyelid and then under as well. It's good for that crepiness. Even people that have had a prior blepharoplasty can have this done. It's usually a series of 4, I think, for the best results. But the Madonna Lift alone, I think, can be really magical too. Sometimes we do that layering effect again about Thermite eyes, which is that radio frequency, and then also doing the Madonna Lift. And then I think now we're going to transition to go to the med spa, where they're going to do, I think, the Clear and Brilliant. They've started that, and then the skin pen. So off.
Tell me when.
Again.
Okay, so right now, Sarah is performing the Clear and Brilliant Laser on our patient. Right now she's using the original handpiece, which is great for collagen stimulation, pore size, fine lines, and wrinkles. It's safe for any skin type. So for people who have darker skin, there's almost no risk of hyperpigmentation. It's fairly comfortable because we do numb you prior. So as you can see, she's not really feeling much. It's just a little bit warm. Downtime is very minimal, so that's why a lot of people love it. You'll get kind of a sandpapery feeling the next day, and then that lasts about 7 days, but no one can see it. So you can resume your daily activities right afterwards. How does it feel for you? Well, a little bit warm. And then after Clear and Brilliant, Sarah is going to do micro needling right over. And this is a nice combination because you're using multiple modalities. So you're using the laser to penetrate the skin barrier and to bring collagen. And then you're using micro needling and causing that controlled injury right after. And so it's nice to get multiple modalities in order to optimize your results. Are you going to do the skin pen? Okay. And with the skin pen, if you do it together with the Clear and Brilliant, you might have a little bit more downtime. Some people get a little bit bloody after the skin pen, but it's just a couple days of redness, and then people will just think you have a sunburn. So nothing too bad. Afterwards, you'll have glowing skin, your texture will be improved, your pore size, and people will think you look amazing or you just got back from vacation because of these treatments. So back to you, Dr. Burgess.
Okay, thank you. So I would say if you're a newbie to this, I would start off with one or the other. I wouldn't do them both at the same time, but many of us that have had some experience and our skin's kind of used to it, we oftentimes will layer some of these as well. But I think it's okay just to start, medical grade skincare, working away with one laser and things like that. Basically, almost everybody can do a Clear and Brilliant laser. Even young people that have acne, scarring, and things like that, to our older ladies and our older gentlemen as well, almost and darker skin types. So basically, everybody can do a Clear and Brilliant laser, and everybody can do the skin pen or the microneedling. It can be really transformative. So I think I'm just going to talk a little bit about Chrysalix and 3D facial evaluation. And you can see here that we have a 3D imaging system. We actually use an iPad, but people from home can also take their photos. And it's on our website about how to take these photos. You can send them in to our Chrysalix site. And we can do a virtual visit where the provider can look at your face, and it's really fascinating. You can see a lot of detail on this. We do it for breast augmentation too, so we can actually have people try on implants, so we can go up in size and down in size, so that people actually have an idea what they might look like after breast augmentation. But we can use it for the face as well, especially for a virtual visit. But I think what we're going to do now is just transition real quick over to the video to show the skincare. And then we'll go to the secret.
Here at Burgess Plastic Surgery, we offer medical-grade skincare lines featuring ZO, Neocutis, Teoxane, and Epionce. Whether you're looking for anti-aging, correction, hyperpigmentation, wound healing, scarring, fine lines and wrinkles, pore size, or preventative measures, our lines cover all of your concerns. We know how important it is to feel confident in your own skin. Tonight would be a great opportunity to start on your skin health journey or maintain your skin health. Stay tuned for more information, and thank you for joining us.
We're going to talk a little bit about the secret. So the secret, our patients have absolutely loved. So one of our best-selling packages has actually been the Hydrofacial Secret Series. And we'll talk about Hydrofacial in just a little bit, but it's like the next gen of facials that will really deep steam clean. For the Secret, it's actually microneedling kind of on steroids. So it's microneedling like the skin pen that we showed you, but it's actually this device that has radio frequency and it actually has heat to it. So we numb up your skin. It has these little tiny needles, and then they're Teflon coated. They go through the skin, they heat, and they come back out. So you don't really have as much superficial like downtime, but you have that heat, that collagen induction that happens. It can be used for tone and texture, especially perioral, kind of things for lines. And you can get some tissue improvement as well. Not like all therapy, it's just a little bit different, but our patients love this. So we now have a Secret Pro, and it has a newer CO2 that's on it. That's an ultralight for photo damaged skin. And then it has the Ultra, which is a little bit more aggressive, and then the Revive. And the Revive will be, and we haven't shared this with everybody yet. So this is just a little tidbit of some of the new things in our practice. But it has a Secret on it, and then actually adding the CO2 right on top of it. So again, a lot of what we talked tonight is about the layering effect. This is the Secret for the arms. It's an off-label use, but we've had some great improvement for underarm area, kind of above knee area, and for some tummy areas as well. And it's usually a series of about 3. So now we're going to go to the clinic spa room for the Secret. So just back to right now with Maggie, our patient's doing Pronox, and Pronox is a nitrous oxide that can make things just a little bit more relaxing, but she also has some numbing medicine on as well. She's going to go ahead and start firing the Secret, which is the microneedling with the radio frequency, and it can feel a little spicy. Everybody's a little bit different, but it's actually pretty well tolerated. If you have a thinner area like a forehead, then I think that can be a little bit more spicy. Thicker areas like cheeks, I think, aren't quite as spicy. It's usually a series of 3, which is really great. And then we really start seeing some improvement probably about like 3 to 6 months. Like it's not just like an immediate effect. And it's something that you might have one little spot that's kind of bothering you, and like, 3 to 6 months later, you're like, oh, that looks better now, kind of thing. So that's okay. I think I just explained about the Secret. So I think we're totally fine. Okay, so we're going to say goodbye to Maggie, but I just wanted everybody to see how well tolerated that is. Okay, bye-bye. So now we're going to talk a little bit about dermaplaning and hydrofacials and things like that. So the hydrofacial is the next gen of facials. I love this, and I think if I ever retire years and years and years from now, I'm taking that with me. So the Hydrafacial is the next gen of facials. It's this device that will cleanse and that will hydrate and exfoliate, and then do different levels of chemical peels. While the pores are open, it will suck the stuff out of the pores, making the pore size smaller. So basically, it's kind of like a deep steam cleaning for the face. We have different brighteners, and the brighteners are different boosters, and some of them can be brightening. We have one with growth factors, and so we have lots of things that can be done. It's really good for actually teenagers and acne as well. We have a treatment for rosacea. I'm telling you, everybody can have a hydrofacial. I love it. The one thing about the hydrofacial is that sometimes I personally do dermaplaning right before. So dermaplaning is this butter blade, and the butter blade will actually remove some of the vellus hair and do some exfoliation as well. I found that sometimes I have just a little bit more hair that just kind of gets in the way of treatments, and you're wasting energy kind of on the hair. So cleaning off some of that can be really helpful and just makes your skin feel really smooth and soft and supple. Dermaplaning is great. The one thing is that sometimes after I do like the Clear and Brilliant Laser, sometimes I come in about a week after, and it might have little tiny scratchy, little stuff, and I'll have them dermaplane. It just takes everything off, and it's a lot less itchy. So dermaplaning by itself, sometimes people do a facial dermaplaning, a dermaplaning and hydrofacial, dermaplaning alone. They'll do dermaplaning after, certain treatments to kind of get off the little crunchies. So dermaplaning is really nice for everybody as well. So I think now we're going to transition and go to room for dermaplaning and hydrofacial, and hopefully this will all work.
All right, so I'm just finishing up dermaplaning on this lovely patient. Another thing I really like about dermaplaning is it helps your products to penetrate better, and it really does help just leaving your skin like really refreshed. I think it's a great addition onto the hydrofacial as well, and I always suggest that to my patients. With the hydrofacial, on this patient, we're just going to do the signature, which consists of 3 serums. The first one is going to help just cleanse and start the exfoliation process. And then after that, we will apply a chemical peel that has glycolic and salicylic acid. And that's going to continue that exfoliation process. The second serum is going to help extract and hydrate the skin. And then the third is going to fuse and protect the skin with antioxidants and peptides. To further protect the skin, we do add SPF on, just because the skin will be a little more sensitive because of the peel. But it's incredible. Your skin's going to be super glowy. And like Dr. Burgess said, any type of skin can tolerate this. So it's great for anyone. Thank you.
All right. And then she's got the Hydrofacial device right behind there too. All right. So I think we're moving on. So we're just going to slide right through the end of the evening for just some surgical options, so that you know that there are some other things as well. But just back for me, combination procedures, these are the things that I've listed here. Good medical grade skincare for myself, dermaplaning, hydrofacial, clear and brilliant, microneedling. I've done scalp PRP, all therapy, Botox. I've done a little bit of everything, because we do these things for ourselves as well. We don't do anything that we don't believe in. So I think that's really important. So that layering look, so this is Sally before, face and neck lift, add a little blepharoplasty and other laser treatments. And is that effective layering that can be really helpful. So for this gal, she was concerned about some of the lines kind of around her lips. And so we did all therapy and some Bolotero. And then she'd had a blepharoplasty, so there's some swelling on the other side, but this is just adding some other treatments, including some Botox. This is skincare and Botox and bluffs, and then adding a face and neck lift and some Smart Skin as well. So you can kind of see the before and after and some of the transformation, but again, continuing to doing some type of maintenance, I think can be really helpful as well. Just facial surgery alone for a face and neck lift with a blepharoplasty. You can see you can have more jaw definition as well, more neck definition as well. And this is actually a gal, super cute, really thick neck, almost like a cow neck kind of sweater. And you can see the improvement. It's hard to see, but she has a little mole that's tucked way underneath the skin, and now it's pulled up here. And you can see some of that skin improvement. It can be done for gentlemen as well. So sometimes people have this platysmal bands that are here. They've lost some of the upper cheek fullness, and they have this kind of heaviness that's down here as well. And some of this can be improved with time. I pull things back as tight as possible, but I want to make sure that people heal well the first time. Super important, but you will get some relaxation. I tell people about a 20 to 25% relaxation over time, but still a remarkable improvement. Another gal here, you can see some improvement in her neck. So she had a face and neck lift with fat grafting. I love doing fat grafting with almost all of my face and neck lifts now. I think if you're just pulling back, that's fine. But if you're pulling back a face and it just needs more volume, you can really improve their facial, basically symmetry and their fullness in their face much better than a face and neck lift alone. Also, and we call that micro fat grafting. We can do it for lips. We can do it for lines. We can actually do nanofat, where the microfat is processed in even more smaller segments, and that can be used for right underneath the skin too. So we've got lots of special treatments here. And then we've been working on our Be Alluring loyalty program. The med spa part is called In My Own Med Skin. And so we want for people to feel confident and look good in their own skin. And now we will have our 2020 Golden Ticket winner. She's prepared a little video for us. So here we go.
Hi everybody, my name is Kelly Shelton, and I was the winner of the 2020-21 Golden Ticket Award. And I just want to let you know that I have had so much fun this year with self-care. This is something that I don't usually do, and so I have enjoyed every moment. Some of the things that stand out for me was, first of all, the warm welcoming that I got from the staff here. I have enjoyed working with each one of them. They have made an effort to get to know me and my needs, and I've appreciated that so much, and they've been flexible with me and my schedule. I'm a full-time teacher, and I have a kind of a tight schedule, and they've been so welcoming and worked well with me with that. In terms of the procedures, I've loved every one of them. It was difficult for me to choose one or two that were my favorites, but I must say that I did love the Clear and Brilliant. I noticed that as soon as I was done with those treatments, my skin just looked more illuminated and it looked more clear. And I also love the IPL, because that one I could see the actual sun damage on my face disappear and more as I got the treatment, and that was exciting. So I feel like I've made a big improvement in my skin tone, my skin texture, and to be honest with you, I just love looking at myself in the mirror now, and I've never liked that before. So I just wanted to say thank you to Burgess Plastic Surgery. I just so enjoyed this year, and good luck to all of you candidates. I can't wait to hear who wins next.
Okay, so she's pretty much adorable. It's been a fun year, with her. So we've really enjoyed having her too. So, well, I think that's about it. So basically, we'll be drawing the golden ticket winner. The golden ticket winner will be drawn on Monday. And so we'll be letting you know. Again, that golden ticket is a year's worth of services, including a maintenance plan, IPLs, Clear and Brilliant, Secret. There's just a lot of things, that we'll be offering for you. So I think that's it. Just call if you guys have any questions, email us if you have any questions. I think that's it. All right. Thank you so much for coming tonight. I appreciate it. Have a good one.